Imagine a simple blood test that could diagnose a complex illness like ME or CFS with 96% accuracy. Researchers from the University of East Anglia and Oxford Biodynamics claim to have developed the world's first reliable blood test for myalgic encephalomyelitis, also known as chronic fatigue syndrome. For hundreds of thousands in the UK, this could be a turning point after years of being dismissed or misunderstood. The new EpiSwitch CFS test promises to identify a unique biological signature in blood, offering hope for swift, objective diagnosis. But such a bold claim demands scrutiny. Can this test truly deliver, or is it too good to be true? As we explore this breakthrough, we must balance hope with scientific rigor and ask, is this the key to unlocking ME/CFS, or just the beginning of a longer journey? ME/CFS is far more than just tiredness. It's a severe multi-system illness that devastates lives. The hallmark is crushing fatigue unrelieved by rest and post-exertional malaise, where even minor activity can trigger days of worsening symptoms. Many endure flu-like pain, unrefreshing sleep, and cognitive brain fog that makes daily life impossible. In the UK, around 400,000 people are affected. A quarter are housebound or bedridden. Diagnosis has long relied on ruling out other diseases, often taking years and fueling stigma and disbelief. Without a biological marker, patients struggle for benefits, care, and even basic understanding. This lack of clarity has hampered research and left many isolated. A definitive blood test could finally validate patients' experiences and pave the way for real progress. The EpiSwitch CFS test dives into the world of epigenetics, how DNA is folded and regulated in our cells. Instead of searching for a virus, it analyzes the three-dimensional structure of DNA in white blood cells, looking for unique patterns. Researchers studied blood from 47 ME/CFS patients and 61 healthy controls, identifying 8 epigenetic markers linked to immune function and inflammation. The test showed 92% sensitivity and 98% specificity, resulting in a reported 96% overall accuracy. For the first time, a simple blood test seemed able to distinguish ME/CFS from healthy individuals. This could be the objective diagnostic tool patients and doctors have long sought. But how robust are these findings? Despite the impressive numbers, scientists urge caution. The study's small sample size, just 47 patients, means results could be skewed or not hold up in larger groups. Crucially, the test was only compared to healthy controls, not to patients with similar illnesses like fibromyalgia or lupus. Without this, it's unclear if the markers are unique to ME/CFS or just signal chronic illness in general. The study was also funded by the company behind the test, raising concerns about bias. Such high accuracy is rare in early-stage research and may not translate to real-world settings. Independent, larger studies are essential before this test can be trusted in clinics. The journey from promising research to clinical reality is long and demanding. The scientific community's response is a mix of optimism and caution. Dr. Charles Shepherd of the ME Association calls it an important step, but stresses the need for more research to confirm the test's specificity. Professor Chris Ponting warns that validation by independent teams is crucial before clinical use. Cost is another concern. The test could run up to $1,000 per person, limiting access. Replication is key. Only repeated, independent studies can confirm these findings. Until then, the EpiSwitch CFS test remains a promising research tool, not a clinical breakthrough. Encouragingly, some markers overlap with those found in the large DECODE ME study, adding credibility. The debate is healthy, pushing the field forward while guarding against false hope. For patients, the prospect of a blood test brings hope and anxiety. A definitive diagnosis could end years of disbelief and open doors to support, benefits, and understanding. For the severely ill, a home-based blood test would be life-changing. But the ME/CFS community has seen breakthroughs fizzle before, and many are wary of false hope. The path from research to routine NHS testing is long and uncertain. Cautious optimism is the message. This is a promising step, not an overnight solution. Larger, robust studies are needed to confirm the test's accuracy and impact. The hope is real, but so is the need for patience. What's next for the EpiSwitch CFS test? The answer: more research and bigger studies. Future trials must include patients with similar conditions to prove the test's true specificity. If validated, these epigenetic markers could also help track treatment progress and accelerate drug development. The technology might even aid research into related conditions like long COVID, which shares many symptoms with ME/CFS. While the 96% accuracy headline is exciting, this is just the beginning, not the end of the diagnostic journey. The study offers hope and a new direction, but it's a proof of concept, not a finished product. For now, we watch, wait, and support the rigorous science needed to turn this promise into a real breakthrough.